Hi, everyone. Really glad to be with you today. So I'm Alex Fleming. I work in the disability unit in the Cabinet Office. I've been asked to describe what I look like. I'm 5'8", curly hair, slightly frazzled, father of 2 young kids under 3, and I'm a glasses wearer. That's probably a good description of me. So as Mark suggested, today I'd like to talk you through a little bit about the disability unit in the Cabinet Office, the national strategy that we're working with colleagues across government to deliver, some of the themes that are guiding our work, and then a few sort of closing thoughts on the role of tech in our thinking. So a little bit about the Cabinet Office Disability Unit first. So we were set up last year, late November. Our primary purpose, at least in our early year or so of existence, is to deliver on behalf of the government a new strategy for disability. We're currently penciled in to publish that next spring on the current timeline. We're really pleased that the PM himself has taken a great deal of interest in this and is showing real leadership on this agenda. He wrote to Cabinet colleagues on the 5th of February, underscoring the level of ambition he wants to see. And there was a Cabinet discussion about this in July, which was great for us. And I suppose his message in both of those, the letter and that setting, was that the strategy must be ambitious and focus on the issues that disabled people say affect them most. So covering all aspects of people's lives: employment, housing, education, and transport. Obviously, this year has been the year of COVID, and as our previous speaker has sort of highlighted with some of the data, the pandemic has really highlighted and sort of magnified, if you like, some of the issues and challenges that disabled people face. And we're really pleased as well that the PM has been really clear to us that the strategy is to be a key part of the UK's renewal from the pandemic. So that's a really important framing that the PM's given us to the work. And I suppose the aim of the strategy is twofold. One is that it should transform the lives of disabled people by focusing on the issues that people tell us matter most to them. And 2 is that it should set out practical actions to improve the lives of disabled people, removing barriers and extending opportunities. So that's our sort of the goal that we've been set. Sorry, just trying to change the slides. There we go. So many of these data, I think, will be familiar to people, but I thought I'd just share a few sort of statistics to highlight some of the challenges and the opportunities that we have in this space. So as folks know, there's 14 million disabled people in the UK, spread across the life course. There's still a significant employment gap between disabled and non-disabled working age people. And there's a large cohort of disabled consumers who Purple estimate have the spending power of about £250 billion a year. So all of this tells us that a huge number of disabled people still are excluded from society despite laws and initiatives to date. So that sets the theme, the scene, if you like, for the sort of the challenges and the opportunities that we're hoping the strategy can start to move the dial on. In terms of our themes and how we're engaging with disabled people and across Whitehall, we've got 5 guiding themes for the strategy. One is supporting independent living. Now that has a sort of covers a multitude of things. So these are things like access to social care, access to a house that suits your needs, finding meaningful work for you, and so on. The second is around accessible built environment. So this is around aids and adaptations to the home, making sure that current building stock and new buildings are fully accessible. The third is around access to justice and rights. Theme 4 is around changing perceptions, so challenging stigma, showing disabled people in a more positive light. And last is one of the themes I lead, which is inclusive products and services. So this is around making sure that all products and services are more accessible to everyone in society. We're also running several cross-cutting groups on many of the similar themes, but we're running one on assistive technology, web accessibility, being part of the community, disabled children, parents and families, and economic recovery. So that work is ongoing, and the idea there is to try and work across Whitehall departments and agencies to see whether we can move the dial on those themes. And last but not least, we've got quite a significant stakeholder engagement effort in the disability unit. So we regularly speak to disabled people's organizations, and we've got our forum for those groups. We speak to the DCC, the Disability Charities Consortium, ourselves and our minister, the Minister for Disabled People, who's a DWP minister, are currently doing a range of online engagement with many of you and many people in communities. We're running challenge sessions across government. We have disability and access ambassadors who are private sector champions for accessibility in lots of sectors. We run that program. And last but not least, we host a regional stakeholder network across England. So through all of those forums, we're having open dialogue and ongoing dialogue around, what the strategy should cover, and what matters most for people. Sorry, I'm trying to move change the slide, but it doesn't seem to be working. So next up, I suppose I wanted a few reflections on what we see as the role of technology in our strategy. We've been partnering with Policy Connect, who are a think tank heavily involved in this space since the summer, really, to try and understand what the problems are and the opportunities are in terms of tech for removing barriers for disabled people. And I suppose this slide seeks to summarize where we've got to in our work. So I suppose the top line position is, our view is that society hasn't taken full advantage of the benefits of technology to remove barriers for disabled people and increase opportunity. That's probably an obvious statement to many of you, but one that's come clearly through in our work. And I suppose in our workshopping since summer, we've identified 3 broad areas where we think policy should be focused. So the first is around design, innovation, and setting standards, as well as sharing best practice. 2 is around access, commissioning, and procurement. So this talks to issues around affordability, whether there are sort of commissioning silos locally, whether people feel confident and enabled to buy the right kit for them. And the last is around culture, awareness, and support. So what we mean here is, for example, do frontline staff within the health system or the education space, or even within the Job Centre Plus space, are they sufficiently aware of the opportunities that tech can give the people that they serve? To what extent do they understand and conduct sensible needs assessments? And to what extent are they able to offer ongoing support? So we think the issues here are multiple and connected, but those are the 3 buckets, if you like, that we're seeking to kind of investigate through our policy development. I suppose the other thing to kind of make clear on the call is that our role in the disability unit is to, first and foremost, partner with other Whitehall departments to get them to do the right thing and to focus on the right areas. That's our primary purpose. And there's a small job that we have to do some policy development of our own accord, if you like. So in this space, assistive tech space, we're doing a bit of both. And as we are still in spending review period and we're not sure where Treasury have landed, we're not quite sure where we're going to be on assistive tech, but we are sure that the centre, number 10, are very, very excited about the role of tech, wanted to play a big part in the strategy. So that feels like a good place to be currently. And then last but not least, I've just left details of my email and Rosie and my team. If colleagues would like to get in touch with us, we'd love to hear from you. But I'm happy to pause there, Mark, and take any questions if people have any.
Thank you, Alex. I mean, that's brilliant. I think you know, the framework that you're describing there obviously is trying to take account of lots of different inputs, lots of different stakeholders, and lots of different work going on. Oh, you're here now. You're, lots of different people getting engaged. From the point of sort of sitting in the middle of the web of that, and looking ahead, what are the likely sort of schedules, do you think? How soon is it going to be before we see drafts and so on? Are you still at the bit where you're beginning to pencil things in? Is there stuff starting to form, you think?
Yes, it's starting. So I think I suppose all of this comes with a bit of a health warning, doesn't it? We're in the middle of a pandemic.
Yeah, I was wondering how that was going to hit you. Yeah.
Yeah. So, and ministers have asked us to focus as best we can on both, you know, immediate responses to COVID as well as produce a strategy at the same time. So that's a challenge and one that we're relishing and we're trying to do right on both those fronts. I suppose in terms of our timeline, if you were to publish next spring, you're talking about a working level draft getting pushed up through ministers this side of Christmas.
Okay.
But there's always an iterative process where, you know, departments, we're in an, you know, we negotiate with departments on a bilateral basis to make sure that they've got the right level of ambition in their areas, tracking where they are with Treasury in terms of spending review bids, always talking to number 10 about whether we've got the right balance of a package and whether we need to push for more or different. But if you assume a spring publication deadline, then working draft this side of Christmas, and then, you know, engagement, you know, up and out to the stakeholder community, but also across Whitehall as we go along. But clearly the spending review feels quite important in terms of, you know, big ticket items that are going to get funded and presented in the strategy. There's also a bit of choreography going on here to make people aware of around how we relate to the SEND review that DFE are leading, how we relate to the autism strategy that DHSE are leading, and there's also a DWP green paper. So there's a sort of spaghetti junction of
I like the phrase. I like the phrase choreography. I could say that sense of all those. You're having your Strictly moment.
That's right. Exactly. I think I'll be voted out in week 2. One of those. It's good.
Well, I certainly. I mean, you've brought to life the complexity of it as well. Of course, that we're not just talking about a single action that's going to sort of affect the lives of just a particular group of people. It's that breadth, isn't it? And I think that's the scale. Just one other question. Do you think, I don't know how far back your involvement goes, but do you think COVID has changed people's attitudes? Is there a sense of sort of maybe a better understanding or clarity of the value of this sort of activity on individual people's lives? We just heard quite a frightening number from Elizabeth about 59% of people who died in the first wave of COVID. These things maybe are coming more to consciousness now about why policy is so necessary in this area. Is that something that you've noticed personally?
Definitely. I think one of the stark things that have been a byproduct of the pandemic, but also provides an opportunity, is just the extent to which it's illustrated some of the existing inequalities in our society. We know that this administration is very interested in ameliorating the differential impacts of those. There was a focus earlier in the summer on BAME, and I think, communities who had been, disproportionately affected, and I think the same is true for disability. whether that's, access and rights to social care. I think on the assistive tech side, the challenge, I think, for us all collectively as government is, as we move to digital models of service delivery, how do we make sure that we don't create new barriers for disabled people, and make sure that disabled people are able to benefit from those, just as every other citizen. So there's sort of, yes, in answer to your question, it has absolutely raised the profile of some of the opportunities that assistive tech gives us to remove barriers. But I think it's all incumbent on us now to kind of work collectively to try and make sure that we use the pandemic as an opportunity for positive change.
Great. Well, thank you. Well, and thank you so much for joining us and updating us. And I know that there'll be lots of questions that have come in. We'll do our best to share the resources out, of course, but also get back to you with some questions. So thank you very much, Alex.